An independent accredited laboratory tested 20 popular SPF 50 sunscreens in 2025. 16 failed to deliver the protection printed on their labels. One product returned a documented result of SPF 4 from a label claiming SPF 50+. The test was run twice. Both results confirmed SPF 4. Government regulators launched a formal investigation. Multiple products were recalled. Today, ranking 10 SPF 50 sunscreen brands, 5 whose labels are a documented lie, and 5 where the formula and the claim are in verifiable alignment. Starting at number 10 with the brand in more pharmacies than any other sunscreen in the United States. Number 10, Banana Boat. The brand positions itself as the family-trusted sun protection default, the product parents reach for because they have always reached for it. Its SPF 50+ formulas retail for $10 to $15. Edgewell Personal Care, the parent company behind Banana Boat, reported advertising and sales promotion expenditure of $373 million in fiscal 2024 against a research and development budget of $45 million. 8 times more on manufacturing trust than manufacturing evidence. Banana Boat's primary UV filters are chemical absorbers, avobenzone, homosalate, octosalate, and octocrylene, compounds that degrade under UV exposure and require precise concentrations to maintain efficacy. The SPF certification on the label reflects a single controlled laboratory measurement, not verified real-world performance across a full exposure period. Independent testing in 2025 found Banana Boat SPF 50+ products failing their stated protection claims. The brand cited its own internal testing in response. 2 laboratories produced 2 different results. One result is printed on the label. The verdict: you are not buying verified protection. You are buying the confidence of a brand that spent 8 times more manufacturing trust than manufacturing evidence. Number 9, Neutrogena. Its market position rests on 3 words: dermatologist recommended. Its Ultra Sheer and Beach Defense SPF 50+ formulas retail for $15 to $22. Kenvue, spun off from Johnson & Johnson in 2023 at a market capitalization of $15.4 billion, owns Neutrogena and funds the clinical adjacent positioning that makes this phrase feel like a medical directive. The FDA has no legal definition for dermatologist recommended in the context of sun care. 8th place. Bondi Sands built its identity on Australian beach credibility. An ABC investigation found that senior industry scientists, including Matthias Rohr, raised formal concerns about Princeton Consumer Research's methodology and calculation practices. Rohr stated he had never seen results like theirs in his entire career. The investigation also confirmed the facility's owner had previously been legally disqualified from serving as a company director. Bondi Sands was among 8 products certified by Princeton Consumer Research that subsequently failed independent testing. The verdict? You are not buying Australian sun expertise. You are buying a certification from a facility whose methodology senior scientists formally questioned and whose operator history is now under regulatory review. Number 7, Cancer Council, the organization whose institutional mandate is the prevention of the disease that sunscreen exists to reduce. Every bottle sold contributes to cancer research. Its adult SPF 50+ range retails for $12 to $18. Of the 4 Cancer Council products submitted to Choice's independent testing in 2025, 3 failed to meet their SPF 50 label claims. The Cancer Council Clear Zinc Kids SPF 50+ was officially recalled by the Therapeutic Goods Administration in December 2025. Multiple Cancer Council adult products were certified by Princeton Consumer Research prior to sale. The TGA launched a formal investigation into SPF testing methodology following the Choice findings. The first formal regulatory review of SPF certification standards in Australia in the modern regulatory period. The organization that created the Slip, Slop, Slap public health campaign was selling SPF 50+ sunscreen that an independent accredited laboratory confirmed was not delivering SPF 50 protection. The verdict: You are not buying the assurance of a cancer prevention authority. You are buying an institutional label whose underlying formula in 3 of 4 tested products did not deliver the standard the institution's entire mandate requires. Number 6 is the most documented failure in this dataset. Ultra Violette Lean Screen SPF 50+, mineral mattifying zinc skin screen retailed for $44 to $55. Positioned at the premium end of the Australian mineral sunscreen market. Independent testing commissioned by Choice in June 2025 returned a result of SPF 4. The result was so anomalous that a second test was immediately commissioned and run through the same methodology. It confirmed SPF 4. Ultra Violette subsequently engaged 8 independent laboratories to retest the product and publish those results publicly. Across 8 accredited facilities, Lean Screen returned the following documented SPF values: 4, 10, 21, 26, 33, 60, 61, and 64, a range of 60 SPF points from a single formula, tested under industry standard protocols. The product was withdrawn from all markets in August 2025. Full refunds were offered to all purchasers. The original certification printed on every sold unit came from one facility at one point in time. The verdict: 8 subsequent laboratory tests found results spanning from medically negligible to twice the labeled value. You did not buy SPF 50 protection. You bought a number 1 facility certified, and 8 accredited laboratories could not consistently validate. Number 5, Cancer Council Kids SPF 50+ Clear Zinc. Same organization as Position 7, same $15 price point. A different UV filter and a different result. When Choice submitted the kids' formula to the same independent laboratory, it returned SPF 52, meeting and marginally exceeding its stated claim. The active ingredient is zinc oxide, a mineral compound that physically deflects UV radiation rather than absorbing it through a chemical reaction. Mineral filters do not undergo the time-dependent molecular degradation that affects avobenzone-based chemical systems. Zinc oxide maintains its protective profile under continuous sun exposure without the photostability chemistry required to prevent chemical filter breakdown. The same testing conditions, the same laboratory, one formulation failed. The mineral formulation delivered SPF 52. The verdict: the formula built for children met the standard on the label. The adult range, using a chemical filter system certified through a different process, did not. Number 4, CeraVe Hydrating Mineral Sunscreen SPF 50 retails for $17 to $20. L'Oreal acquired CeraVe in 2017 for $1.3 billion and positioned it within pharmacy distribution rather than prestige retail infrastructure. The active ingredients are published on the label: zinc oxide and titanium dioxide at disclosed concentrations. The inactive ingredient list names 3 specific ceramides: ceramide NP, ceramide AP, and ceramide EOP, compounds documented in peer-reviewed skin barrier literature for their role in maintaining the stratum corneum. No proprietary complex name obscuring undisclosed ratios. The MVE delivery system releases these ingredients progressively over 24 hours, documented in cosmetic chemistry literature. The markup runs approximately 3 to 4 times production cost. The margin attributable to clinical grade manufacturing rather than advertising infrastructure. The verdict: you are paying for a documented ingredient architecture with named compounds and published concentrations. The price and the formula are in alignment. Number 3, Altruist. Founded by Dr. Andrew Burney, a British dermatologist and skin cancer surgeon with one stated objective: make SPF 50 affordable. The formulation complies with EU Cosmetic Products Regulation SPF testing standards, which require independent accredited laboratory testing before an SPF claim can legally appear on a product label. This is a pre-market verification requirement that does not exist under the US self-certification model. In 2025, the Sun UK named Altruist SPF 30 Best Overall Sun Cream across its comparative testing. No celebrity contracts, no influencer budget, no retail counter infrastructure. The markup runs approximately 3 times production cost. The verdict: You are paying for a dermatologist's clinical formulation at the price point he determined was necessary to make daily use economically viable for everyone. Number 2, EltaMD UV Clear Broad Spectrum SPF 46 retails for $45. The active ingredients appear on the FDA-registered drug label with precise percentage concentrations: zinc oxide at 9.0%, octinoxate at 7.5%. EltaMD registers its sunscreens as OTC drug products with the FDA rather than as cosmetics, a classification that requires active ingredient concentrations to appear on the label. The SPF number on the label, 46 not 50, is the detail that carries the most forensic weight in this ranking. The brand printed 46 because 46 is what the formula returned under testing. That decision to report the measurement rather than optimize the label for commercial appeal is precisely the behavior that earns position 2. The verdict: the active concentrations are regulatory disclosures, and the SPF number reflects the documented test result. Both constitute honest alignment. In first place, La Roche-Posay Anthelios, owned by L'Oreal since 1989. The Anthelios SPF 50 Plus retails for $30 to $38. Its UV filter system uses Mexaryl SX and Mexaryl XL, photostabilizing compounds developed through L'Oreal's research division. Mexaryl SX, chemically identified as E-Camsul, received FDA approval in 2006 following a formal new drug application review, the only new UVA-specific filter to receive FDA regulatory approval in more than 2 decades. Clinical data on Anthelios formulations has been published in the Journal of the American Academy of Dermatology, the British Journal of Dermatology, and the Journal of Investigative Dermatology. The Mexaryl patents are public record. The mechanism of protection is not a marketing claim. It is a documented chemical photostabilization process with a regulatory approval history that predates the brand's current market positioning. Independent testing across multiple countries confirms the SPF claim consistently. The markup runs approximately 3 times production cost, attributable to patented filter technology and pharmaceutical-grade manufacturing. The verdict: the label, the formula, the regulatory record, and the clinical literature are in documented, verifiable alignment. Across all 10 brands, one structural condition holds. An SPF number is a label claim produced by a testing facility. In 2025, 16 of 20 independent tests found the number on the label did not match the result on the skin. The brands that failed transferred the burden of proof from the formulation to the marketing infrastructure. The brands that earned their position made the formulation verifiable, published active concentrations, peer-reviewed clinical records, regulatory approval histories, and accessible public databases. The stakes are not cosmetic. The active ingredient list is the first thing to read. The number on the front of the bottle is the last.